Hi, I'm Kim and I'm the student nurse tonight. Can I have SBAR on your next patient?
Yeah, no problem. The patient is Greg Lutz. He's a 67-year-old male. He was admitted for a diabetic ulcer on his right heel that's just not getting better. He says it's been there about 3 weeks. He's been soaking it at home, still not healing, and also his blood glucose levels have been high. They've been about 300 for the past 5 days, and usually they're around 120. His last A1C 3 months ago was 5.2%, and he has a 20-year history of type 1 diabetes. He is insulin dependent, so we'll be giving him insulin today. He is alert and oriented ×4. The only neuro issue is he has some tingling bilaterally in the lower extremities, but other than that, he's doing pretty well. He has a 1,800 calorie diabetic diet with a 2-gram sodium restriction, and he says that he drinks a 16-ounce can of beer each Friday when he goes bowling. Other than that, denies any drug use. So his vitals are pretty decent. He's on room air. His last blood glucose was 242. So we will be giving him insulin, both NPH, and then he has a sliding scale for his regular insulin.
Okay, and why is the patient receiving this medication?
Because he's a type 1 diabetic, his pancreas doesn't produce and secrete insulin like it normally would, so we have to give him the insulin injections to help his body move the glucose into the cells and the skeletal tissues.
Okay, so I would assume that's the action that it has on the body?
Yeah,
Okay.
yeah.
When should you question administering this medication?
If his blood glucose levels were low, so if the reading was 70, or if he was having signs of hypoglycemia, if he was diaphoretic, had changes in his level of consciousness, or was feeling weak, dizzy, that type of thing, we definitely want to consider holding off. Also, if his level was very high, we would want to call the physician before administering insulin.
Okay. Does this medicine have a therapeutic serum level?
It does not.
Okay. And which vital signs must be monitored?
It's important to monitor all your vital signs, but the blood glucose is our best indication both of how much we should give on the sliding scale and also afterwards whether the insulin's having the effect that we'd like.
Okay, and which physiological parameters should be monitored when the medication is administered?
Well, you definitely want to watch for any signs of hypoglycemia, like we went over earlier. And also, there can be redness, itching at the injection site, so look for any injection site reactions at the time too. And also, if there's any lipodystrophy, that's possible as well.
Okay. And what interventions must be taught to the client to ensure the medication is safely administered both in the hospital and at home?
Okay, so in the hospital, one of the big things is the patient does have the right to refuse, which is important because the patient oftentimes knows their medical history as well or better than their providers do. So they may question, why am I getting this medication because I usually get something else? And if that happens, you need to respect that. Also, making sure that they're getting the right medication at the right time, the right route. The documentation needs to be appropriate as well. You want to check for allergies, and also you want to make sure that you're using clean techniques. As far as at home, they need to make sure that they're storing their insulin properly, rotating their injection sites, and disposing of their sharps appropriately.
Okay. And what are the side effects and potential adverse reactions of the medicine?
Well, one of the big ones is the potential for hypoglycemia. And then there also are the local skin reactions that can occur. One of the biggest ones is if they don't rotate injection sites, they can end up with the thickening of the skin, which is that lipodystrophy, and that's something we avoid by having them rotate injection sites.
And how will you know if the medication is effective?
We will be rechecking his blood glucose level after administration to see if it's coming down into a more normal range.
Okay, well, that's all I have for now. Thank you.
All right, thanks. So I'm going to knock on the door. Knock, knock, knock.
Come in.
Hi, Mr. Lutz. How are you doing today?
Good. How are you?
I'm doing well. It's time for your insulin injections. Your blood glucose level was 242, and so you'll be getting your 20 units of NPH, and you'll also be getting 16 units of regular insulin.
Okay.
Do you have any questions about your medications?
Nope.
Okay, and do you have any allergies?
I don't.
Okay. And I'm going to use the hand sanitizer.
Hand washing is important.
It is.
Yay.
How's your pain right now?
It's okay.
That's good. Can I have you verify your name and date of birth?
My name is Greg Lutz, and I'm 67 years old.
Okay, great. I'll be scanning you as well in just a moment.
Mm-hmm.
You can go to your Yahoo email, your email, whatever email you use, and then you can request your username and password.
So I'm going to be scanning.
It wouldn't be a
Some
Yahoo.
problems again
It would be
here.
just
This new system is taking some getting used to.
Those pesky computers.
Right. Okay, let's try this again. Okay, it seems happy now. This is for the regular insulin.
If you ever requested my password or username, you can check there. Like anytime I forget, I use my Yahoo email and check it.
Okay, we're just going to scan your ID and we're on here.
Third time's a charm.
I hope so. Now I'll scan the medication. Okay. And I'll be giving both of the medications in the one syringe because I am able to mix the NPH and the regular. So, is this how you do it at home? You draw back the air before you put it in?
Mm-hmm.
That's good.
Sure, yeah.
Yeah, okay. So 36 units of air. And I will be cleaning the tops of both of these. Yes. into the regular, and then withdrawing the 16 units. And I'll have another nurse verify this as it is a high risk medication. Okay. Verify that for me. That looks like 16 units.
Mm-hmm.
Okay, great. Now I'm going to withdraw the 20 units. And we'll have 36 units total in the syringe. And I'll have you verify that again for me.
Yes.
Okay. I'll be sticking here. And I just need to scan you one more time.
So, yeah, and what your courses email that you use to register for this. Yeah. But if you know which one you use, I think you can request, say, forgot password or something.
Okay.
Do you know your username?
And do you have a preference on where you have it injected?
Well, last time did it on my arm.
Did you forget?
Okay. Is it okay if I do it in your belly this time?
Sure.
Okay. So I'll be doing it in the left lower quadrant right here. The right lower quadrant. Yeah, whichever one. Okay. In the belly. How are you feeling?
Good. Time for donuts.
Oh my. I did bring by some information on diabetes and food, so you can see how alcohol and also some of those simple carbohydrates like donuts kind of affect you. And also, this is about diabetes and foot care.
Oh, thank you. I'll read those over while I eat my donuts.
Okay. Great. Is there anything else I can do for you right now?
Nope.
Well, that was fun.
Yeah.
I do have a few more questions for
Okay.
you. Were there any pertinent pieces of information that you reviewed before administering the client the medication?
I did review his latest blood glucose reading because his insulin was on a sliding scale for his regular insulin. And
Okay.
so that would have affected how much he got or possibly if he got any at all.
Okay, well, that was my next question. Was if it affected your decision to administer the medication?
It did. It verified that it was appropriate to administer the medication and also that that was the appropriate amount to give at this time.
Okay. And did this information affect how you administered the medication?
Well, no, not really.
Okay. Well, that's all I have for you today. I appreciate you letting me follow you around.
Okay, thanks. I'm just going to finish up my documenting the patient teaching.
Okay. Bye.
Thanks.